Okay, so knocked on my door and introduced myself to my patient. Hello, my name is Lori Minton. I'm a nursing student from Bellarmine. I'm going to do a dressing change that's been ordered for you today on your abdominal wound. Can you tell me your name? Okay, can you tell me your date of birth? I always want to check two identifiers. Wash my hands, and I'm going to put on regular gloves. And this is an abdominal wound, a wet to moist dressing, so I'm going to raise the bed to my height. Okay, I'm going to put this rail down. It's okay because I'm on this side of the patient. When I finish, I'm going to put that rail back up. So I'm going to uncover this wound and keep the patient covered. I'm going to go ahead and position my table. So always remember you can move this to whatever is easiest for you. And I'm going to go ahead and remove the old dressing first. And before I get started, I would have come in here beforehand to let the patient know we were doing this dressing to see if they needed to be pre-medicated. I'm going to just gently remove this old. And the whole time I'm doing that, I'm inspecting the wound to see if there's any type of drainage, and I would document that and document what the wound bed looks like. So I've removed those gloves. Wash my hands again. You don't need a lot of hand gel, just a little bit. And I've got a few supplies here. I've got my tape. I'll go ahead and get a few pieces and just kind of put towards the end of the table here. Put that to the side. I've got my gauze that's going to go inside the patient. This is a sterile package. I'm going to just gently peel it open and pull back while it's on the table so that I'm not reaching over it. And I don't want to do it up like this because then the gauze will probably fall out. Same thing with our cover dressing, the combine dressing. Just gently pull back. If it rips, that's okay. Just put it to the side. Q-tips, which I'll use to help me pack the wound, won't always open very easily, so I'll just gently peel it back. Hold on to the bottom part here. Not opening as easy, but get there. If it starts to come out, then it wouldn't be sterile anymore. I might just leave it just like that. My gloves, I'm going to have an extra pair too. My gloves I'll put on last. I'll go ahead and just take them out of the package that they're in. Everything within the packages is sterile. My solution, I want to go ahead and verify what type of solution I have. It should have a date on when it's open. What I'm going to do now is called lipping it, and just kind of gently pour a little bit out on the same side that I'm going to pour it on the gauze. I'm coming around. I'm not going right over top. I'm coming around. Just a little bit there to moisten. If I didn't think it was enough, I'll put a little bit more. I'm also going to make sure that I wring that out really well. You don't want a dripping wet gauze inside the wound. I'm going to open this up. So, likes to flop back forward, that's okay. Just give it a little bit more push. First glove I'm going to put on, I can only touch the outside cuff. So my hand, this hand, my nice clean hands, I can't touch the sterile part, which is the outside. So I'm going to work my hand in there, just gently. It would be best to take off any jewelry or watches. I have my watch removed. So if you think about what the gloves are, they're like this on the inside of the package. So the left hand will be here, the right hand will be here. Once this hand is on, my dominant hand is on, then I'm going to go ahead and get the other one. I'm picking this up by the inside of the cuff. The inside of the cuff is sterile. The part that's going to touch my skin I need to make sure that the sterile glove and my hand that's ungloved yet are not touching. I'll get my hand in there. Now my gloves are on. This is a sterile field. I can stay within it. I can stay within the middle of these. I want to keep away from about that 1-inch border. Always keep your hands in front of you and don't turn your back on your sterile field. So I have 2 gauze here. I'm going to pick that up from the middle, wring that out, keeping my hand up, no lower than my waist. I'm going to open this up and fluff it a little bit so that I can fill that wound bed up. And I'm going to grab one of my Q-tips. It might be a little tricky, but got it? Okay. My Q-tip's going to help me pack that wound in here. Remember, all this is sterile, so I can touch over here. I'm going to keep the majority of the gauze in my hand and then just kind of gently use the Q-tip so that my hand doesn't have to be inside the wound bed. And I'm going to keep the gauze from touching the outside skin as best I can. I'm going to go ahead and get the other one. Again, wring it out over the garbage. Open this up. The way I'm kind of working here is keeping my hands up, being within a sterile field. Okay, I've got it fluffed out, stretched out, and I'm keeping it kind of in my hand here. I'm going to get this other Q-tip. Came out really easy. And just gently kind of work that gauze in here, filling that wound bed up. Trying to keep the wet gauze off of the good tissue on the outside. Use my hand a little bit, make sure that that wound bed is filled up. So once my wound is covered, I'm going to take my top dressing, my ABD, open it up, and it's going to lay just on top. Once that wound bed is covered, now I'm okay to go ahead and touch my tape. I don't have to be, worry about contaminating my gloves anymore. I talk to the patient and make sure that they're tolerated this procedure okay. Once this is covered on all sides, I'll possibly go ahead and make a label that has the date and time and my initials on the dressing itself and kind of put that there so that the next person coming in knows when that dressing was done. I would also give that a report to the next shift. I'm going to go ahead and cover this patient back up and make sure that all my safety things are done. So putting the rails up, make sure the bed's locked, putting the bed in a low position, make sure that their personal belongings are close by, cleaning up my area, and making sure they have their call light before I leave and any questions are answered.